Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello everybody, I'm Dr. Santhosh Kumar, specialized in ENT and currently practicing at Nizamabad, and I'm about to address about a condition which is vertigo a serious condition? Understanding when vertigo is harmless and when to seek help. In most cases, vertigo comes from the inner ear but not the brain. This is called peripheral vertigo, and common causes include benign paroxysmal positional vertigo, which is in short form BPPV, Meniere's disease, vestibular neuritis. These conditions can feel intense, they can disturb daily life, sleep, confidence, even your ability to move around comfortably. But in most cases, they are not life-threatening. Take BPPV, the most common causes. It happens when tiny crystals in the ear move out of a place and send incurrent motion signals to the brain. It feels dramatic, but it's not damaging to the brain. Meniere's disease can affect hearing over time, which is significant, but again, it's not typically life-threatening. And vestibular neuritis often improves gradually, although some people may need rehabilitation to fully recover. For most people, the honest answer is this is distressing, this is disruptive, but this is not usually dangerous. Vertigo becomes serious when it comes from the central nervous system, which is brain. The most important cause to consider is stroke, especially when it affects the cerebellum or brainstem. What makes this tricky is that early stroke can sometimes look very similar to a peripheral vertigo episode, but the key difference is urgency, because stroke treatment is time sensitive. You don't need to learn complex medical tests like HINTS exam, that's for clinicians. What matters is recognizing this. Vertigo plus neurological symptoms is a warning sign. These include slurred speech, double vision, facial drooping, weakness or numbness on one side, trouble swallowing, severe or sudden headache, or being unable to stand or walk properly. If this happens, together with vertigo, that's not a wait and watch situation. That's an emergency care. The most important relevant condition here is vestibular schwannoma, also called as acoustic neuroma. It's a benign, slow-growing tumor of the vestibular nerve, gradual hearing loss on one side. Importantly, it usually presents with tinnitus, slow onset imbalance, not a sudden but spinning severe vertigo. So while it's a real condition, it's not the usual cause of an acute vertigo episode. Exactly. A clear diagnosis tells you what's happening, what's not happening, what treatment is appropriate, and warning signs actually matter. And if someone has been told it's just anxiety without a proper vestibular neurological evaluation, it's reasonable to ask for a more specific assessment.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.